Hi there, this is Laura Kim from section 32, and I'm gonna read exercises for the book Professional English in Use. Exercises from Unit 5. Write sentences to describe the work of the specialist in each branch of medicine. Look at the opposite to help you. 1. Dermatology. A dermatologist specializes in diseases of the skin. Rheumatology. A rheumatologist specializes in arthritis and other diseases of the joints, muscles, and bones. Traumatology. A traumatologist specializes in fractures, wounds, and injuries caused by accidents. Pediatrics. A pediatrician specializes in babies, children, and teenagers' care. Obstetrics. An obstetrician is a specialist in delivering babies and giving care to pregnant women during the pregnancy and after the birth. Complete the table with words from A, B, and C opposite to and related forms. Put a stress mark in front of the stressed syllable in each word. The first one has been done for you. Specialize will be the verb, and then the noun specialist, and then the noun for activity or thing, speciality. We have practice, then practitioner, practice. Consult, consultant, consultation. Assessed, assistant, assistance. Graduate, graduate, graduating. Qualify, qualified, qualification. Exercise 5.3. Find prepositions in C opposite that can be used to make word combinations with the words in the box. Then use the correct forms of the words to complete the sentences. A pathologist specializes in diagnosing disease through examining cells and tissue. A pediatrician must enjoy working with children. An oncologist is a specialist in the diagnosis of treatment of cancer. A physiatrist must be good at counseling. A neurosurgeon must be good with her hands. Make words combinations using a word from each box. Two words can be used twice. Look at B, C, and C opposite to help you. General practitioner, consulting rooms, group practice, health center, internal medicine, surgical specialties. Now exercises from Unit 6. Make word combinations using a word from each box. Look at B and C opposite to help you. House officer, associate specialist, ward round, on call, radio pager, provisional diagnosis. Match the descriptions 1 to 5 with the job titles A to E. Look at A and B opposite to help you. Dr. Graham has been a pediatrician for 8 years and is responsible for treating the children admitted to Ward 60. That should be a consultant. Dr. Stewart has just started the second year of her foundation program. That's the SHO. Dr. Singh has started his training as a surgeon. That is a specialist register. Dr. Phillips has just graduated and is working in a large hospital in Birmingham. That is an PRHO or house officer. Dr. Miller is in charge of the medical staff in the Birmingham hospital. This is medical director. Are the following statements true or false? Find reasons for your answers in A, B, and C opposite. Number 1. A medical graduate becomes registered 2 years after graduation. False. It's after 1 year. The system of training doctors in Britain is called the Foundation Program. True. The name senior house officer is no longer used in Britain. False. The consultant is usually the first doctor to see new patients. False are the juniors for these consultants. When working in shifts, all doctors take turns to be on call. True. Complete the text of a PRHO describing her job. Look at A, B, and C opposite to help you. When I get to the work, the first thing I do is talk to the house officer who was on duty during the last shift. to find out if there have been any new admissions. Then I generally see the charge nurse. He tells me if there is anything that needs to be done urgently, such as intravenous lines to put up or take down. Later in the morning, clerk any new patient with basically involves taking a history. On Tuesday and Friday morning, the consultant does the hair wire rounds, and I have to make sure I'm completely up to date on her patients. After that, there are usually lots of things to do, like writing up request forms for blood tests, exams, and so on. In the afternoon, I have to prepare for any patients who are to be discharged the next day. They are usually happy to be going home. And then, of course, there are the lectures and tutorials in the foundation program on Monday and Wednesday. Exercises for Unit 7. Complete the sentence. Look at B and C opposite to happy. Someone who specializes in delivering babies is a midwife. Someone who is qualified to assist nurses is a clinical support worker. Someone who is not qualified but is able to assist nurses is a nursing auxiliary. And a nurse who has qualified is a staff nurse. A nurse who specializes in health promotion is a health visitor. A nurse who looks after a ward is a charge nurse. A nurse who works in the community is a district nurse. Someone who answers the ward telephone is a ward clerk. Make word combinations using a word phrase from each box. Look at the opposite to help you. Carry out a procedure, change sutures, check the temperature, giving an injection, remove a dressing. Complete the sentences with the correct grammatical form of perform. An isotope brain scan is painless and easy to perform. Biopsy of the pancreas was performed last March. If the patient's condition deteriorates, a laparotomy should be performed. If a diagnosis of meningitis is suspected, a lumbar puncture must be performed. Last year, we performed a randomized double-blind group study. Complete the sentences with the correct grammatical form of carry out. I now intend to carry a larger study. Unfortunately, few properly controlled trials carried out so far. A number of studies were carried out recently to look at this question. A right hemicolectomy was carried out and the patient made a full recovery. This procedure can be carried out in the emergency department. Exercises from Unit 8. Make word combinations using a word from each box. Look at A, B, C, and D opposite to help you. Occupational therapist, social worker, ambulance technician, artificial limb, club foot, contact lens, intraocular pressure, health professional. Which allied health professionals could best help the following people? Look at A, B, C, and D opposite to help. A young unmarried woman who has just had a baby. That will be that will be a social worker. Then a woman who is having difficulty using her right arm following a fracture. I have the health professional that we need will be a physiotherapist. Then for someone who needs glasses, an optician, an elderly woman who has had a below knee amputation, that will be a prosthetist or occupational therapist. Then we have a man whose wife has Alzheimer's disease. There's gonna be social worker as well. A man with a fungal infection of his feet. That will be a chiropodist or a podiatrist. Complete the test. Look at A and C opposite to help you. A protested works with patients of all ages as a member of a clinical team based at a large hospital. The patients may need a prosthesis as a result of an accident or orthosis following a disease such as diabetes. Alternatively, they may have been born without a limb. Orthotists work alongside doctors, nurses, and physiotherapists, and occupational therapists to give the people under their care the best possible rehabilitation. Their main aim is to enable the patient to lead a normal life at work and leisure. An orthotist often works in a clinic as part of an outpatient service and also visits other centers to provide a service for people with special needs. They deal with people of all ages. For instance, children who have cerebral palsy may require splints to help them walk, and many older people need special shoes to correct deformities. Um, if damaged, any part of the human skeleton may require some form of orthosis. The orthosis may be needed to reposition the body or to relieve pain. Exercises from Unit 9. Complete the table with words from A, B, and C opposite. Put a stress mark in front of the stress syllable in each word. The first one has been done for you. The verb admit, admission, assess, assessment, discharge, discharge, operate, operation, refer, referral, treat, treatment. Make word combinations using a word for each box. Look at C opposite to help. Acutely ill, assessment unit, on duty, referral letter, waiting list. Which hospital department would be most appropriate for the following patients? Look at A, B, and C to opposite to help. A woman in diabetic coma, intensive care unit. A patient who has just had a radical prostatectomy, surgical high dependency unit. A patient who is to have a skin lesion removed, outpatient department. A man with a foreign body in his eye, day surgery unit. A woman with a treated abortion, outpatient department. Complete the track form and information lifted for patients. Look at A, B, and C opposite to help you. Information for outpatients. When you arrive at the hospital, please tell the receptionist who will welcome you, check your details, and direct you to the waiting area. The length of your visit will depend on the treatment you are going to have. You may need to have some exams, such as an x-ray, which could mean going to another department, or you may be referred to other professionals, such as physiotherapist, or dietitian. You may need to revisit the clinic if staff at the clinic want to see you again. Another appointment will be arranged for you. If you need to be admitted to a hospital for more treatment, either as an inpatient or for day surgery, you will be told when this is likely to happen. If you do not need further treatment, you will be discharged to your GP's care.